Have you started feeling pain in the ball of your foot in between your third and fourth toes? Or maybe it feels like something is inside your shoe, but when you check, there's nothing there. You may have a condition called Morton's neuroma, which is the topic of our video today. But before I get into this, I'd like to introduce myself. I'm Dr. Ryan Berg, and I've been practicing podiatry for over 40 years in Seattle, Washington. I've written an ebook to help you learn more about this and other ball of foot conditions. How to stop your ball of foot pain. You can find a link to download it in the description below. Also, if you find the information in this video helpful, please remember to like, hit the subscribe button, and then hit the bell so you can receive a notification every time I release a new video. So what is Morton's neuroma? I know it sounds like a tumor, but it's not. It's an enlarged growth of nerves that can develop between your third and fourth toes in the bottom of the foot, and it's benign. While men can get this condition, women are 8 to 10 times more likely to develop it due to the types of shoes they may wear. First, let's talk about the cause of Morton's neuroma. When the bones of your foot rub up against the nerve, they can irritate them and cause the nerve to enlarge, turning into a neuroma. Neuromas will start small. Over time, they'll progress, getting larger and more painful to the point where it really makes your day difficult. The most common triggers of that nerve irritation are the types of shoes you wear. If you wear pointy and or high-heeled shoes, you're more likely to develop a neuroma as you jam the ball of the foot into a tight space. That's because these shoes exert a lot of force on your toes. The higher the heel, the greater the force. The tighter the toe box, the squeeze gets bigger and bigger. Having an abnormal foot structure, bunions, hammer toes, flat feet, and flexible feet are all an increase of developing Morton's neuroma, although you can get it as well with a really high arched foot. Trauma, dropping a heavy object on the foot or other injuries to the area. Participation in sports, activities such as running, hiking, or playing court sports, all may aggravate the nerve and developing the condition called neuroma. So what are the symptoms of Morton's neuroma? We've already mentioned pain, but you can also experience tingling, numbness, and burning. You can also feel like you're walking on a pebble or have a sock wadded up in the ball of your foot. Initially, these symptoms will occur occasionally, usually when wearing shoes that aggravate it or engaging in certain physical activities such as dancing in heeled shoes, hiking downhill, or cycling. These symptoms usually subside when shoes are removed or the activity stops. Over time, however, the symptoms will worsen, particularly as the neuroma enlarges and the temporary changes to the nerve become more permanent. It can become difficult to walk or participate in your usual activities without pain. Morton's neuroma can be treated through various methods. Some of these treatments can be done at home. Home treatments include such things as icing to relieve inflammation and swelling. You can use a bag of frozen peas or an ice pack for 20 minutes on, 20 minutes off, a couple times a day or after your activities. A ball of foot pad or metatarsal pad can also provide the support the foot needs to prevent the metatarsal or the base of your toes from becoming cramped and pinching the nerves that cause this problem. You can either use a pad that comes separately, or you can place in your shoe, or you can also find an over-the-counter insert that includes a metatarsal pad to push up just behind the ball of the foot. So when you place the pad, make sure it sits just behind the area where you'll see in your shoe a little imprint of the ball of foot bones. Change your shoes by eliminating use of high heels and shoes with a narrow toe box. If you do this, you can reduce the rubbing on the nerves which causes the pain. Instead, opt for a shoe that has a wider toe box or is more open in the forefoot like a sandal. Avoid wearing socks that will compress the toes too much in the front of your shoe. You can also change how you lace shoes. For example, instead of lacing your shoes starting at the bottom, move up one eyelet. And that'll provide less compression in the ball of the foot and relieve the pressure on the toes and the nerves. Also, if you have a narrow heel and your feet tend to slip forward in your shoe, you can try another lacing technique called a heel lock, and this will help hold your foot back in the shoe. I'll put a link about it in the video above. In addition to home treatments, we'll provide several options to help you get relief from your neuroma. First, we can often recommend custom orthotics for our patients who have abnormal foot structures such as flat feet or even really high arches. Wearing orthotics can realign your feet and take the pressure off the nerve. We provide ultrasound-guided injections of alcohol in a very small amount, which will help shrink the neuroma, and often use MLS laser therapy, along with the injections to reduce that inflammation and pain while stimulating healing. MLS laser therapy is a cold laser that works to increase the blood supply and circulation to the area being treated, and as a result, the tissue ultimately is healing itself at the cellular level. If the neuroma does not respond to conservative treatment, surgical removal may be necessary. In conclusion, if you started feeling the telltale signs of Morton's neuroma, try some of these home remedies I've recommended. If these don't relieve your pain, come in so we can get you back to doing the things you love to do. And remember, if you've enjoyed this video, don't forget to like, hit the subscribe button, and then hit the bell so you can receive a notification every time I release a new video.